diagnosis, if the patient had same disc, same place, same problem, they differ in behavior. The symptoms are different.
It's a very individual one-on-one kind of
thing.
One-on-one kind of recipe, like similar to an investment advice where it's very individual to the person.
Psychology and psychiatry are like software, whereas neurology and neurosurgery hardware problems.
Hello, welcome, and thanks again for coming back to Walks of Life. It's a web series and a podcast that we do where we meet very interesting people who come from different walks of life, and we're going to talk about their life, their journey. Today, I am pleased to have with me my guest, Dr. Raghu Shamla. He's a neurosurgeon. He's going to tell you about his experience as an entrepreneur starting up a clinic. We are going to talk about neuroscience. And we are going to talk about, in general, how doctors think about money and, how they find stock markets. And being a doctor, they are very smart people, and stock market naturally attracts a lot of smart people. So what is the connection there? We're going to talk about these kind of aspects. So Dr. Raghu, thank you very much for sparing time for us.
Thank you for inviting me.
First, I've known you for some time. I've known Dr. Raghu for, few years. I requested him for his presence, and then he gladly agreed. So first, let us talk about your childhood. Where did you grow up, and what attracted you to medicine?
So first of all, thank you for having me here. You motivated me to do this basically. So basically, I am from in Telangana. So it's a remote place. It's around 10 kilometers from my district center, which is Nagar basically. So my basic education was in my village itself till 7th. Then I studied till 10th class. And
what is the name of the village?
It's a Tankara.
Okay.
Yeah. Okay. It's a Nagar district basically.
Nagar.
It is from here. It is roughly around it's 100 kilometers away.
100 kilometers away.
Yeah. So till 7th class, I studied in my village, and then 10th it's in a government setup again. Then +1, +2 I did in Hyderabad. So basically I was from Telugu medium. The first time I converted it to English medium in the +1, +2 thing.
Okay. We can't tell. I mean, you're as fluent as anything. So the first time you came to city Hyderabad,
it was literally it was a new world altogether.
Did you have relatives to host you, or
no one?
Okay, so was it scary?
My teacher dropped me in the campus and he left. Then we used to go only during the festivals. So other than that, you are in the campus.
Okay.
So yeah.
And then you cracked the exams and
exams. Yeah.
So tell us about your qualification.
Okay, so I did my MBBS the Osmania Medical College. For both AP and Telangana, that's the most famous, the most government kind of thing. So where all the bright minds will go again. So I did my MBBS from there in the Osmania, and then I pursued my MS, that is general surgery. So from the beginning, I had a mind of going into the medicine and then to the neurosurgery. So I opted for this surgical branch.
Where did you do your MS?
That I did from PGI. Chandigarh.
Okay, wow, that's top notch also.
That is, it's a very good institute, obviously. It was for 3 years, and then there's no further, I had to wait there for some more time for the neurosurgery to get into. Then I moved to AIMS.
AIMS Delhi?
Yeah.
Okay, so
I was there in AIMS for 3 years for MCH neurosurgery, and then I did my subspecialty. This is super specialization, and then the neurosurgery itself has multiple branches.
Okay.
Like spine, some people will deal with the stroke, some people will deal with the tumors.
Okay.
It's kind of that. So I'm more into the fits, surgery for fits, the Parkinson's disease, those kind of things.
Yeah, Parkinson's is there is a lot of innovation happening.
It is exactly like what Elon Musk is doing. So he's implanting the brain chips.
Yeah.
So similarly, we insert the electrodes inside the brain.
Wow. Okay.
So it is kind of that.
We can maybe even touch upon that if you would like to talk about that.
Sure.
So illustrious career, as you can see, and top-notch surgeon in our company. So let's talk about your entrepreneurial journey. So if you have recently started a clinic, where is this clinic located? How many people are involved? What kind of services?
So I started practicing outside of the government institute. It's been 3 years. Overall, my experience coming to the neurosurgery, it's 2014 onwards. So it's been almost 10 years. But my career as a private practitioner, it's been like last 3 years.
3 years.
So I started my clinic, which is named as a Proxima Super Specialty Clinic.
Proxima Super Specialty.
Yes.
So, Dr. Raghu, you were talking about your clinic, Proxima Super Specialty in Kondapur. So, we are currently in Gachibowli area, right, in Hyderabad.
Yes.
So, if somebody wants to go to your clinic, what's the way to go? What's the general direction?
So, two things. One is it's nearby Chirek School.
Opposite?
No, it's to just go across the Chirek School. There's a one junction is there. Take right. There's a Kotak Bank and Starbucks. Just by the side. It's in the 3rd floor.
Okay, very good. So it's a very easily identifiable.
Yeah, you can otherwise you can Proxima Super Specialty Clinic.
Yeah, you can Google
will
guide you there. Great.
This is basically the idea is that all the people who we did 5 people are there in that. So one of them is my wife. So all of them are trained from the top institutes.
Yeah.
So all of them are from Osmania, where I did my MBBS. We are long-term association with them. We know each other. And all of them down to earth. They're not we want to get money from the patient. It is not like that. And everyone is very well trained.
Yeah.
It is not that specialized. So with the 5 people we started it.
Are all these all the 5 people from neurosurgeon? So what are their specializations?
So myself is from neurosurgery. The other guy is there is Madhu. Dr. Madhu is from urology.
Urology.
Related to the kidney surgery, renal transplant and all those things. The second is Dr. Naveen is a gastrosurgeon.
Okay.
So all the abdomen, esophagus, the whatever the food we eat, all those things he will do with oncology.
Okay.
The cancer treatments and everything he does.
Okay.
My wife, Dr. Uma, she does pediatric cardiology. Placing, closing the holes in the heart and placing those things. She also practices the adult, but the predominant area of interest is that
pediatric cardiology. Great. So it's a big setup in the sense there are 5 doctors. So tell us about your thought process. You're doing private practice. You decided to start a clinic. How did you kind of find the location of the clinic? What kind of experience? Because these are very common for all entrepreneurs. When they're starting out, they have to find a location where they can appropriate location. And tell us about the kind of considerations you had about the location.
So initially when we started looking for it, 4 or 5, we have completely we have roam around the city. So where is it the best place? How to go about it? So initially we wanted to create some clinic in some other's clinic, which is already running. Okay. And that was kind of 5 to 10 kilometers away from all of our homes.
Okay.
So in a single day, it is good for us. After finishing our daily routine by the 5 o'clock, and we have to go to that place. So when in Hyderabad the traffic is there. One day, 2 day we can do it, but in the long run, so if we want to sustain it is difficult. So we wanted to keep it one that is closer to our houses so that we can be around. Even if you're at home, if the patient comes, we can just go there. There without waiting time. The second thing, the area. So where the people are there, where other clinics are not much as of now. When we
less competition in the same.
Less competition. And also the people are much educated and affordable. See, to provide the quality of services, you need the money. You cannot mix both. I want quality of the services and I don't pay the money. That will not happen. So all of them are super specialized and all of them are very experienced. And to provide a good quality of care, that needs the infrastructure and expertise. So that is what we looked at it. So before doing it.
And how did you decide 5 is enough? Maybe why not with 3 or?
Maybe because we were very closely associated from the beginning. And all of them from different specialties. So none of them are there are no conflict of interest with the others. So there's no other neuro guy, other gastro guy, other kidney guy. So there's no other one. So it is that 5 who known to each other, who came from the humble backgrounds. So the compatibility will be there.
That's actually one of the main things I find very attractive about your profile is that coming from that humble background, you have scaled to the very top of the pyramid in terms of qualification. It's a commendable journey. I think it's extremely rare and extremely special, and I'm grateful that you've chosen to speak to us about this kind of journey.
Thank you.
So Proxima Super Specialty is a place where we can get good service. And I think one of the things, for example, which I find is a luxury, is that no queues, right? No wait time. So if if somebody goes to that Proxima Super Specialty Clinic in Kondapur, I think you can get good service at with less waiting time for busy people who might still want to consult in private or do these kind of things.
That is for sure. And the people here are more oriented. So the idea of these people whom we come together is that they want to connect to the patient. It is not about a single disease we cured or something. So we'll have the discussion, open discussion. We'll give the guidance. If they may not get treated by us, some of the people, they go for the second opinion, third opinion, the things. So a proper guidance is first what is needed, and the rest of the thing the patient will decide based on the finances. There are many other factors, the location wise, there are so many other things. By the people, what we have is that they can guide you. Okay, in terms of diagnosis, they are good, and in terms of the guidance, like where to go, whom to consult if we are not treating them.
Sure, you can also provide onward referral.
Yes,
guide them towards the right, hospital which has the facilities for completing that process, surgery. So those are, you can get unbiased
reports,
those kind of things. So that's great. So, what are the typical, concerns when you see a patient? You triage them, right? To figure out what's happening with this person. Do you often get patients who already know that they have a issue with?
No, most of the people, some of the people, a long association, they get the patients. One of my old patients, they'll call me. I'm getting so and so complaints, and that we're coming where we do it.
Okay.
Most of them, 70% of the patients, they're new. They just walk into your room.
No. So my question was more as a patient, are they aware that they are suffering from some neurological symptoms, or is that a difficult process for a layman to know that I need to consult a neurosurgeon?
There are misconceptions are there. See, for example, so people have headache. So most of them, in a day out, stressful night, sometimes they go with the the simple paracetamol or some taking rest, that will go. There's no harm in it. Sometimes people have persisting headache which will not relieved by anything. There's some vomiting, some vision defects, then some weakness. Literally they want to move the hand but they're not able to move. So that is a serious condition.
Okay,
then they need to go to see a doctor, kind of.
Sure. And so tell us, typically what are the typical kind of patients you see? How do you what are the buckets of patients you typically put them in?
Yeah, it's a variety of patients. Some of the patients are so the most common what we see in OPD, we go to a clinic or hospital, 50 to 60% of them consist the headache and the back pain.
Okay.
Those two things. The headache mainly related to work stress, or some of them will have migraine. Predominantly, there are some other 100 diagnosed are there, but predominantly these two people are there.
Yeah.
The second thing is the back pain. The back pain, mostly the people who come to the back pain is the software engineers who have the sedentary lifestyle. They sit at the desk for the quite long time.
Sure.
So morning to evening. So they will have it. Very few people, they will come, they have some fall or some accident or some other thing.
Trauma
related. Yeah. Minor trauma, they'll come later. Any major trauma, they'll come to emergency. Anyway.
Sure.
These are the major. So other than this, the tumors are there, birth defects are there, they have some spinal cord, the developmental issues are there. So there are so many other issues, they also come, but they form 10 to 15%. The rest of the people are formed by this.
Two large blocks. Yeah.
Blocks are this.
So as a layman, I've seen these series like House MD or these Good Doctor,
so
fascinating. So these are always there is this miracle event happening in hands of doctor. Can you tell us about some interesting cases that you have seen?
Okay, so there's so many. So I can tell you so many things. So coming to my specialization, I'll tell you the better way. Simple one is the spine. Some people have the back pain, the sciatica. Many people will complain. The back pain was there, and it is going my leg. So that we are seeing many board hoardings where the sciatica problem is there. There are so many advertisements homeopathy, Ayurvedic, and so many things are there. So those people come. Usually those people will have some disc inside their body that is coming out and causing pressure over the nerves. So they have the pain over the back and pain entire the leg. So just we do the MRI, then we'll know it. There is something very small disc. It is like, hardly like 15-20 grams disc is that. So then we do surgery, which is like hardly like 1 hour surgery usually. Sure. It's a 2 centimeter incision. When we close it, when they heal it, most of the times we don't even make the scar also.
Okay.
So we can discharge the next day. They're back into the like normal life again.
Really, like just one day after the surgery.
Yeah. The initial pain is there for 4-5 days, but once it is healed, it will take 10 days, and after 10 days they're back into the normal life. So such is the thing. But for this to come to this station to undergo surgery, the patients will like almost they take 4 to 5 months, 5 years.
5 years.
Some people they'll suffer it. When this is done, when that's the next day. Today we do the surgery. Next day when come out of the theater, they are awake and all right. They say, I would have done this like 5 years ago.
Yeah, people are very scared, right? If you do surgery in spine, like what if I get paralyzed? Is that a real risk, or is
it was there. It was previously, like if you consider like 20 years ago, it was there like that.
But now the technology has improved so much.
Technology improved. The understanding of the brain and the nervous system has improved. All the hospitals which are providing the infrastructure is much bigger.
Okay.
So it is like much less chances. Like if you operate, the average point of view I'm telling, if you operate like 100 patients, there will be some problem, 1 or 2 patients. The 98% of the patients, they go without any these things.
So that kind of accuracy, I don't think we have in any other profession.
That is what I'm saying. This is so good nowadays. So people come with the idea, see, my neighbor has got something, then he died. That is different. It's a case scenario is different. So we cannot just generalize that to his condition.
And people are, of course, scared to have general anesthesia and go under the knife.
Definitely.
It's something.
Anyone does that. Everyone will have that fear.
But I think a very important point is that if you are suffering, and because the technology has improved so much in last 20 years, including the facilities, I think getting it treated as soon as possible will basically make your life a lot better for the next few years. That you would have suffered, irrespective of having to know that there is a cure that you can get which is affordable, and then you're just suffering because of the fear of unknown, which is kind of
so the thing is like the way what we look, particularly the Indian population, is that so if you're going for a surgery or something, when for example let's take the common condition, the back pain itself, so they're suffering every day. The quality of life is bad. Obviously they're not going to participate in many of the activities, not focusing on the work. Even some of them have the sexual life problems, like the pain because of and all those things.
Sure.
So when you compare the quality of life and the amount of money we go for surgery, okay,
it's a no-brainer.
There is no break. It is far better than something.
So it's just
it is just like mental block that we should not go to that.
Yeah. No, that is, I think that's a fair point. I think, people are they want to avoid surgeries. Like, can I get some medicine and get it cured? Like, no, you can't, right? I mean, this has to be, so this has to
be. Just because of that, many people will go to multiple doctors. So, hoping that this doctor will tell me that he will cure me without surgery. And they end up landing over the years and then finally going for it.
Ayurveda, then homeopathy.
This neurosurgical problems cannot be cured. There are some chronic conditions like asthma, bronchial asthma, the skin allergies, skin related issues, some joint pain, some autoimmunes, we call them. So they are to some extent, they give you some result over the time.
Yeah.
So when the patient is someone says he is candidate for surgery, none of the other treatments are not there to relieve that thing.
Yeah, and surgery was invented in India by Shushruta. So it is an invention of India, and it's an Indian heritage, and we have probably the longest track record of doing surgery in the world, right? So
no, we are not like when compared to the expertise and the facilities, the India is not lacking anywhere.
No, certainly. I think Indian doctors and Indian facilities are world class. I think there's probably we'll soon have medical tourism like we are already having from the African countries, even for developed countries. I think
most of the Indians who are staying in US and UK, they're coming here for the treatment and then getting back.
Yeah, certainly. And and the comfort, right? You can speak to the person who is going to, in the Western countries, there's a triage process. First, you go to a general practitioner, they refer you to a hospital. The hospital might not have a vacancy for a OT of that nature, so they'll send you to some place. So it's very impersonal triaging, whereas here you have a very personal
directly access. You have the direct access when compared to other system where you have to go through the levels. In India, just can go to a neurosurgeon and just tell me I want MRI, you can get it done. That is a luxury here.
Correct. That is indeed the point. So any peculiar cases it was a mystery and then you solved it, can you remember?
So basically my specialty is epilepsy. Epilepsy is like fits. The fits is a thing, they consider brain is an electrical structure, complete brain. It is like a motherboard basically. So if the brain goes, you're off, you're nowhere. Like the system doesn't have any values. So one of the child, it's like a 6 years child, he came with the fits. So we have the main treatment of the fits in the surgical aspect is you have to find out where it is coming from. It is like a CID job. You have to find out where it is coming from. Sometimes the areas are so minute. Sometimes even 2 mm area in the entire brain might be causing it. So we have to pick that up. We have to get that and catch hold of and then do the surgery. So we had one 6-year-old guy, so the school child who has having like persistent seizures. He was having 20 fits in a day.
20 fits in a day.
So because of which the parents are with him, so they are not going to the work. The economic crisis has come. They were not able to send the child to the school also. Even. So that to that extent. So then they came to us, and then we run the series of tests. It was very difficult to find out. 3 other colleagues we put together and we stormed our brains for almost 3 hours. We've seen the scan and again and again and again because it's not so obvious. So the tumors, they're like, see, I'm here. It will tell us. When I open the scan, it will tell me. So I'm here, just take me out. But for the epilepsy, it is the other way around. It will. Some of the cases are so difficult. Even however you are experienced, you can't find it. So he had very small lesion, like the brain was abnormally formed from the birth. So we call as FCD, focal cortical dysplasia. So that we could able to do it, and other investigations are there. We call them video EEG, we call them PET scan, and all those things put together. It was corresponding to that area. So then we plan to remove it. The second stage, the second problem is, first is identifying it, localizing it, where it is coming from. Once that is done, the second is how important that area is to the rest of the brain. Since there are some areas where the vision is located in some part of the brain, the word what we are speaking is from some other, the language what we understand from some other area, then the memories we have is another. So if you remove those parts, you'll have that problem. So if I remove the parts which are pertaining to the memory, there will be memory loss. So if you're going for the vision area, he will be blind. So similar to that. So for this guy, so it was just area where the hand is being controlled, just like 2 mm just behind it. So chances of getting weakness of the hand very high. Right. Very high. So
little child.
Yeah. The patients also, the parents are like very emotional. They'll be, and once this right hand is gone, the schooling and everything, life, the problem will start.
Yeah, it's different.
Yes. So then the comes is like how to go about it. How do we not reach the area which is controlling the hand during the surgery? So when you go to open the brain, it is all like fatty thing. You might have seen the brain of a sheep or something.
Sure. Yeah.
So it is not written there, this is hand area, this is kind of thing. We have some clues. So we cannot exactly say, so this will control the hand, this will not. Every individual will have some variations are there. So we have to identify intraoperatively, when we open the brain, we have to identify that particular area. First of all, that was a difficult thing. So for that we use navigation, something called. So it is like GPS. So we acquire MRI, we load into the system that will give us wherever we touch, it will say that, okay, you're here. On the screen, we'll know it.
Okay.
So in the brain, we just, by the naked eye, you can't find it.
You need those systems.
For that. That is the one thing. Second thing is to confirm that area is the one which is firing it, which is producing that abnormal electricity. So there is called some ACOG, electrocorticogram we call it. So we place some electrodes over the brain, on the brain directly, and we record the activity again. So we'll see which area is abnormal. We map that area. Then third step comes, we give some current during that time. So sees to see the movements of the hand.
Okay.
So if it is away from that, then we're going to take this out.
Okay. Okay. So it's a pretty
it's a fascinating thing, basically.
Yeah.
So we did that with that kid. So he had mild weakness. Despite doing everything that we could do, we used navigation, we used motor mapping, we used cartogram and everything. There was some weakness in the hand. So that is because of the swelling after surgery, whatever happens because of that. So over next 1 week, he was fine. Now he's going to. We operated him like 2 years ago. Now he is like fits free completely.
Wow.
He's going to the school, and mothers are there. Their
back
own,
in their
own
lives. Yeah. It's it's three people's lives, right? You saved, not just one person. So
it is, definitely.
It's not just.
So that gives, when the complexity is more, it gives us more satisfaction.
Sure. And obviously, it is the most complex thing that.
Exactly.
So coming to complexity, markets are also very complex, right?
Obviously. I tried my luck also.
Yes, and doctors by nature are well-educated, intelligent people, and I've seen many doctors also want to also get attracted to stock market because it's a place of complexity. I think there's a particularly innate attraction towards complexity. So tell us, Dr. Raghu, as a doctor, when you think about stock markets, about wealth, what comes to your mind? Like, what are your initial thoughts?
So I partly tried it.
Okay.
Like considering the same thing, you have tracked neurosurgery and you did the thing. Obviously, you can do better in stocks also, right? That is the principle. What you usually think. But yeah, I failed it miserably. But the difference is that we have spent 20 years of time in this thing.
Correct. In studying
for example, if you consider neurosurgery, so I started my journey in 2004. This is 24.
Wow. Okay. So
it is 20 years.
20 years.
I'm spending my time. So I've seen so many number of patients. I've studied so much. I've gone through so much literature, whatever published so far worldwide. I have attended so many conferences. I've given so many lectures. So many things are happening. So even then, every same diagnosis, if the patient had same disc, same place, same problem, they differ in behavior. The symptoms are different.
It's a very individual one-on-one kind of thing. One-on-one kind of recipe, like similar to an investment advice where it's very individual to the person. So
so in that case, like if I can say to some extent with this much percent that you may get cured. I cannot say 100% I'll get cured. So if someone is saying that, means either he's not done enough surgeries, okay, or he must be God.
Must be correct. I think
these two things. Like say when I operated only two patients are they're doing good, means that 100% success. But I cannot operate 1,000 patients and all of them are good. That's a lie.
That's a lie. Yeah. So with experience, you get as with longer track record, there might be some periods of underperformance. Similarly, in medicine also, when you have had long case history, there will be some oddballs that are just the act of God, right? I mean, we can put our skill to a problem, but beyond that, there is always luck, which we cannot control.
That is beyond anyway. Or
correct, yeah.
Similarly, what I'm saying is the stock market or the financial services are similar. So I cannot go 3 days, 4 days and attend 4 conferences. I cannot invest it.
Sure.
It is like becoming doctor by studying a month.
Yeah, by Googling, which we all do. Try to become doctors by Googling. Don't do that. That's what irritates doctors the most. Google mein aisa padha tha. Nahi, don't do that. There are better answers which you can get from a qualified doctor. So Dr. Raghu, I think, it is a fantastic, fascinating discussion. Just last point, maybe very dumb question, as a layman we confuse neurology with psychiatry with psychology, so tell us, these are all related to behavior and how people function. Can you just lay it out for what kind of symptoms should be directed towards neurology, what kind of to psychiatry, what kind of symptoms to psychology? Can you tell us, please?
So all of them are related to the brain, be it psychology, psychiatry, or neurology or neurosurgery. All of them are related to that. The key difference comes is the psychology and psychiatry are like software. Okay, they are with the thought process. Basically, the thought, whatever the functioning is happening, like it is a virus comes, the system will all go out. It is similar to that. It's a software problem. But it's a neurology and neurosurgery hardware problems.
Very, very good analogy. I think it's very clear.
That is. So if a psychologist does is he counsels you. By doing it, he will change your thought process. Okay, if you like most of the motivational speakers, you don't have the urge to go for like studying, so they'll talk to you, they'll inspire, they quote something, they'll over the sessions they will make you think in a particular way. That is a job of a psychologist. Basically, it's a cognitive behavioral therapy. We call something else. So that is psychiatrist is when this thing will not work. There's some major disorder, like major depression. If you run an MRI, it is normal. There is no other problem will not be there.
It's a behavioral problem.
Behavioral problem. So it is a problem of thought process. So for that, like one is a depression, one is we call schizophrenia. Some is maniac disorders, anger managements. Then some people have OCDs, obsessive compulsive disorder, which is called, they do the same thing repeatedly, like excess obsession with the cleaning, excess obsession with doing some work again and again, making want to perfect something. So those are all cases which cannot, they want to control it, but they cannot.
It's beyond
their control,
self-control.
Self-control. So these will go to the psychiatry. So they will combine the CBT, the cognitive therapy, what the psychiatrist will do. Then other than that, the medication.
Sure.
So these two are purely medical, or you can say interaction, counseling kind of things. These two. Whereas the neurology and neurosurgery. So neurology is the one. Sometimes these are all they deal with the medication. Whom the surgery is not needed. Sometimes, for example, migraine. So surgery usually not needed. Very distant case surgery is needed. This is done by them. Fits most of the times is done by them. Okay. So then it is like acidity. So acidity, if there is acidity, what we do? We take medications. We don't go for surgery.
Sure.
So it is similar to that in simple terms.
That's very clear.
Yeah. So it is in neurology is those people who have the brain and spine issues or the muscle issues, but they do not need a surgery.
Got it.
The process is so diffuse, and the surgery will not help. We have sometimes entire brain is involved, entire spine is involved, spinal cord involved. We cannot remove all of them.
Sure.
Okay, those things are from a neurology. The surgeon's job comes when there is a tumor is there. When there is an abnormal part is there which is causing problem, then the neurosurgery part, like appendicitis.
Understood.
What do we do? We remove it.
So if there is a physical change in the hardware needed,
physical change, the software part is usually neurology, psychiatry, or psychologist. Any of these things.
Sure.
If there is something to be removed out, is the job of a surgeon, basically.
Surgeon, yeah. So basically fix the things, by removing the problem from the site, right? Basically, removing a bug, not in the software sense, but let's say you have a faulty chip, you remove that and everything works fine, right? So something like that. You initially mentioned, about Elon Musk's Neuralink and how that is getting used. It's can you tell us where is, can you, from a neurosurgeon's perspective, what are your thoughts when you see Neuralink or when you see Elon Musk's company?
It is very fascinating to see him. Probably, if not Elon Musk, someone else do it in future. Where he's trying to do it is like, you want to put some chip over the brain, very small part of the brain. See, the chip size he has mentioned is like a size of a thumb. Insert in the brain and do it, kind of thing. So by doing it, a particular part, we can stimulate it. So, or we can extract what it is processing, and then using AIs, we can convert that into something else.
So can we record dreams? Is that a possible
dreams? I don't know. As of now, I don't know.
Okay.
But if you look at the Stephen Hawking, how is he able to talk when he's not able to talk?
Yeah.
Still, he is able to communicate with the world. He is able to write the books and able to give the talks. So there are some things in the brain where we can capture the activity by the analyzing various people, thousands of population, how the brain is reacting for each stimulation. We can using AI and the algorithms, and we can convert that into a function.
Yeah, it is actually, I don't know if you have come across this fact, but the genesis of AI actually happened in medicine, because that was the first data set that was used to train the initial AI model. So the fact that we use AI in markets, actually the doctors invented AI in the data sets, and software engineers together with the doctors. But I think it's a fascinating discussion.
It needs much more. The brain is much more complex than what's
Of course.
what's they're doing right now. It will take time. This is I think the baby steps towards it.
Perfect. It was great
Yeah,
talking to you, and we learned a lot today about things we didn't know. And thanks for watching. And I think once more, maybe like when you see any other case, we'll do it again. So
we'll do it again.
So are you going to the clinic?
And now I have to go.
You have to go to the clinic. So great. Thank you. And
Thank you
thanks for
very
sparing
much.
time.
Yeah. Thank you very much for having me.